everyone. My name is Sharon Carson. For those of you who do not know me, I am the manager of the We Serve program here in Drexel Biomed. First of all, I'd like to welcome all of you and thank everybody for being here today to learn more about our We Serve program. I'd also like to welcome Chairman Stan Strother, who's agreed to be with us here today on such short notice, and we really appreciate you being here with us. And to all the guests who are here to be a part of this program. Just to tell you a little bit, and actually before I do that, I also want to acknowledge that this program is being supported by the Biomedical Engineering, the School of Biomedical Engineering, Science and Health Systems, as well as the Office of International Programs. I also want to acknowledge today that the lunch that you've just enjoyed has been through compliments of Dr. Owen Montgomery. And
you got applause for the lunch?
Yes, it's the start. There'll be more, don't worry. I also would like to acknowledge the Office of Multicultural Programs, as well as the Office of Diversity and Equality, who has helped to arrange the program for today. And again, I'd like to say thank you to them. To begin the program, we will have a couple of presentations for you today. And I just want to quickly, and you'll hear more about this, but I just want to quickly acknowledge our We Serve students, because it's because of the students, such as many of you here, that this program really started. So if the students who've already participated in the We Serve program would please stand up. Zane unfortunately could not make it. Alexa was one of our initial students who really inspired the rest of us to start on this project. And it's obviously generated a lot of excitement. So I think we're going to go a lot of wonderful places, and with the passion and the energy that all of you students are bringing, I'm sure that we have a lot of exciting things in store with what you are all going to be able to do. With that, I'd like to invite Dr. Banu Honoral, the Director of our School of Biomedical Engineering, Science and Health Systems, to say a few words.
Thank you very much, Sharon. Let me just thank you first of all for organizing this, and not only that, but taking the lead on this project that is not just limited to biomed. It emerged with the biomed students, but it rapidly extended to the medical school now, to nursing, to public health, to other engineering and science departments. So I think, and also hopefully our business students and our information students and our law students also will be interested, because this is the future. The reason why I say this is very simple. All these programs that are led by the students are led by the future leaders. And this is how we look at all the students here, is that those who will change the world and make it a much better place than how you found it. We, in my generation, tried, did not succeed as well as we would have hoped. So we put all our hopes onto you, and we are behind you in whatever you want to do to truly bring not only services through your innovations to the underserved, the underprivileged, those who have not had the opportunities. We are counting on you to create a new model of life, which is perhaps the next generation nonprofit. These are scientists, engineers who understand the end user and the needs of the end user, and basically step back and work with the end user. It could be a patient, it could be a clinician, it could be a public health professional, it could be a nurse, and step back and help the solutions eventually not only be designed, created, but also moved and used to the benefit of those who so deserve it, but they did not have the opportunity themselves. So that is the big framework. But what drives me, what motivates me to support the students is that this service program, hopefully across the university and maybe in the region and becoming a national, maybe international operation, definitely with sites internationally, that we serve through our innovations. It's not about serving and leaving. It is about legacy. It is about sustainability. It's about staying with the problem. And if you cannot complete it, hand it over to the person who would do it. Then make sure that they continue to do it. Stay the champion. Do this service, which is, I think, very new concept of serving. Serving through innovations. Now, I'd like to give you some good news. Last 2 days, Drexel was in celebration because we have, in the last 5 years, worked with a foundation partner, Kultur Foundation it's called, and with them, with 10 universities selected out of 80+ universities, for 5 years we worked and learned as students and faculty how to take an idea and with our clinical partners at the beginning and when necessary with the patients to take it from one step to another, closer to the end user. This program was about working with industry, the for-profits, but obviously in parallel, we immediately began to think, if we can do this with the for-profit world, we should be able to do it in some fashion, in some incarnation, in some modification, in some reinvention with the nonprofits. Or many of you sitting here, or those who will join, will create those next generation nonprofits that are very committed to the sustained mission that eventually the what is called now with the general term global health doesn't stay a big nebulous concept, but it has very tangible pathway to what you want to accomplish. So Kultur Foundation created with us this $20 million endowment, which we will use to move discoveries from the labs where our students and our faculty are working on some sort of good idea that hopefully will benefit healthcare. But also in parallel, we are determined to start, hopefully in partnership with Engineering World Health. I don't know, we have representation here today, because where Kultur Foundation already invested some funds, hopefully we find that new model. And it will be all based on the next generation. We will have in those projects, and we already have students deployed with our nonprofits already, partners of our nonprofit, but we will have students doing this as freshman design, as junior design, senior design, master thesis, whatever it takes, until the technology's risk is eliminated. And then somehow these students working with partners in various sectors, it could be government, it could be for-profit, it could be foundation sector, whatever it is, that they will shepherd this thing to the patient. So this is a very important responsibility, and like I say, we trust the next generation. I see also young faculty here, especially from biomedical engineering. You have that responsibility to work with the students, to truly, yes, I'm looking at Shrek.
I know.
You have to. I'm not talking with the young Maggie, you're from my generation, the failed generation. Yeah, that's why we're banking on them and the students. Yes, but the key thing here is to change the way we think, to change the way we find meaning in life, the way we build our careers. It's going to be in the world, and I hope I will see it before I die, because I worked toward this all my life, but the times were not ready. Now that the students are the drivers, I think we are ready, and we're going to do this. And thank you, Shirin, for doing this. Now, I'd like to recognize also here Owen Montgomery, one of our parents, who also took upon himself to be that face of the program in our medical school. So I'm very happy that we have a champion. And we also hopefully do have champions in the public health and in nursing and in other colleges. So that is very, very important that it be a grassroots, that it rise from the sort of the true committed, groups of people at all ages, but hopefully led by young people. Now, when I say this, I also want to add to this that our students are not limited to our university. They are not limited to our region. They are not limited to the nation. they are not limited to the world, actually. They can be anywhere in the world, like some of our students have been. They can be elsewhere in the world where there is an unmet need, and they will go assess it, address it, and make it a project for their life. So I am very, very hopeful, and thank you once again for taking on this responsibility. Thank you.
Thank you very much, Dr. Honorable. And just for those of you, again, who do not know, we do have the champions here. Some of them have already been, and you're going to, of course, hear about Caitlin's experience from a student perspective. We have 3 more students that are leaving in a few days, and actually next week, to go to the Gambia. Vanessa and Owen Montgomery and Paresh Kumar. And then Marco will be following them shortly after in June to go to Mozambique. So, and again, this could not have been possible without the support of Dr. Julie Mostow, our Vice Provost from the Office of International Programs, and I'd like to invite her to come up and say a few words.
Thank you, Sharon, and thank you for all of your hard work. Thanks to everybody, Vanu, and of course to the students who really were the drivers for this wonderful program. As somebody who's worked in development for over 20 years, what makes me particularly proud about this program is the way in which the students understand that they're not going to tell somebody else somewhere in the world what to do. What they're doing is taking the skills that they have, the knowledge that they've gained here at Drexel, and through their co-ops or other kinds of work that they've done, their research, and going and working with partners, finding out what the needs are in the community, and seeing what they can do to support those needs and to build some of the skills and competencies in work with the equipment in the region, in our partner hospitals and clinics. And that to me is an extremely important lesson. The kind of humility that they bring to this program is what we really need if we're going to work together to make the world a better place. And so I salute not only the adventuresome spirit of our students and the eagerness to participate in programs like this, but also the way in which they are approaching the issues of development. And of course we have some people here who are experts in development and who have also spent their lives on that, and we are very happy to have them say a few words. So I'm going to introduce you to our next speaker, who has spent his life also reaching out to communities and bringing his knowledge, his expertise from a different field, the field of finance and management, to peoples across the world. And that is Stanley Strotter, who is the chairman of the Mayor's Commission on Africa and Caribbean Immigrant Affairs. He is also the chair, and I didn't know that, of the Mayor's Commission for Relief in Haiti, and something that we have been particularly interested in. We have a serve group on our students and our faculty. So that's something in addition to some of the other things I'm going to read to you. Now, I'm not going to read these 3 pages because I know that you want to hear from him, but I do want to let you know some of the things that he's been involved with. So, he serves as Director of International Business Development in Financial Management Consulting Practice of Thomas Cobb Bazillo and Associates. And through this, he's been able to provide enormous amount of support and consulting advice all over the world. With over 30 years experience in international development, he has lived and worked in several countries on the continents of Africa, Central Asia, the Caribbean, and Russia. As a finance specialist, Mr. Strotter has provided services to foreign governments in governance and transparency, worked with finance ministers, and provided advice and counsel to governments on trade policy and foreign direct investments. He served as a consultant on two numerous organizations and boards to mention here, not only abroad, but also in Philadelphia in the United States. Speaks French and has considerable experience I mention the language because those of you who know me from international area studies know that this is one of the things I encourage you also to do, is to learn another language. And I see Professor Karen Cross sitting here, who struggled to do Spanish and had a fantastic experience, even better experience than he would have had in his work in El Salvador. So he speaks French and has considerable experience working with bilateral and multilateral financial development entities such as USAID, African Development Bank, African Development Foundation, Eastern Caribbean Investment Promotion Service, and the U.S. Trade and Development Administration, and the World Bank. He has experience in such countries as Cameroon, Egypt, Brazil, Nigeria, Haiti, India, Cote d'Ivoire, Ghana, Guinea, Haiti, Jamaica, Kenya, Israel, Niger, St. Lucia, St. Kitts, Senegal, Togo, Virgin Islands, Russia, Uzbekistan, Zambia, Zimbabwe, and South Africa. Where haven't you? What a wonderful list. And so, in addition to this, he is also a senior advisor and consultant to large and small, both public and private sector organizations and nonprofits, and is engaged in many community organizations, in international development organizations, and has consulted with and directed several organizations founded by the late Reverend Leon Sullivan, one of our Philadelphia heroes, including his OIC International. He serves on a number of boards throughout the city, the nation, and internationally. He is chair of the board of the Constituency for Africa in Washington, D.C. He's chair also of the board for the Center for Black Culture and International Understanding, and he is honorary consul for the Republic of Guinea. So, as I said, there's so much more I could say about him, but let's hear from him himself. Thank you all for coming, and thanks to Chairman Stanley Strother.